Hi there. Have you ever wondered how your body stops the bleeding from when you get a cut? Well, that's called hemostasis. It's the stopping and cessation of bleeding. Even though the hemostatic mechanism may not stop bleeding from the larger blood vessels, they are better effective in closing smaller ones, like a cut. Well, hemostasis has three mechanisms: vascular spasm, platelet plug formation, or blood clotting, also known as coagulation. So the first mechanism is the vascular spasm. With vascular spasm, this is the first and most immediate role in hemostasis against blood loss. With this, it constricts the blood vessels from letting out more blood. This is stimulated by pain receptors and lasts about a few minutes until the other two mechanisms start to initiate. As you can see right here with the vascular spasm, the blood vessels are trying to contract from seizing the blood from exiting the wound. Then we have platelet plug formation. The endothelium is coated with a platelet repellent called prostacylin. So when blood vessels are broken, fibers are vulnerable to blood. When touching collagen fibers, platelets grow pseudopods that bond vessels and platelets together, forming a wall in a way. This large amount of platelets established is called platelet plugs, and this helps slow down or halt small amounts of blood. While this is forming, platelets go through degranulation. This is the exocytosis of their cytoplasmic granules and release hormones that help hemostasis, such as serotonin, a vasoconstrictor. Adenosine disphosphate attracts platelets and stimulates degranulation, and thromboxane A2 stimulates agranulation, degranulation, and vasoconstriction. So lastly, we have coagulation, blood clotting. The goal for clotting is to transform the plasma protein fibrinogen into fibrin. This sticky protein connects all walls of all the vessels. Coagulation has two pathways: eccentric, sources external to the blood itself, and eccentric mechanism. The eccentric mechanism starts by clotting factors released by damaged blood vessels called procoagulants and prevascular tissue. These release lipoprotein mixture called tissue thromboplastin factor 3. This then fuses with factor 7 that make a complex. When this complex is near calcium 2+, it initiates factor 10. On the eccentric mechanism, initiation of this is present in plasma or platelets. Platelets degranulation then release factor 12. Then continuing through cascade reactions, a series of reactions which depends on the production preceding, thus activating factors 11, 9, and 8, and lastly factor 10, which needs the presence of positive calcium 2 and platelet factors 3. Factor X then fuses factors 3 and 5 with the presence of positive calcium 2 and platelet factors 3 to then make prothrombin. Activator, this then acts upon a protein called prothrombin factor 2, which then changes into thrombin, an enzyme. This then converts fibrinogen into shorter strands of fibrin monomers, like we mentioned earlier. Continuing, these fibrin polymers covalently bond to each other end to end to form longer fibers and fibrin polymers. Factor 13 helps make these strands dense aggregations that help the structure of blood clots. When this starts, then the damaged vessels heals more quickly. Thrombin then works with factor 5 to speed up the production of prothrombin activator, which produces more thrombin, and this is the completion of coagulation. And right here in the blood clotting area, we see the fibrin all around the platelet plugs.